I am Marcelle, leadership in education in neurodevelopmental and related disabilities. I'm also a family faculty and coordinator at Rose F. Kennedy Center, family specialist at the project that I would like to talk about today called Children and Youth with Special Healthcare Needs. I'm also a mom, a single mom of 17 years old twins, boy and girl, and as many other moms in America, my children have special health care needs, and my son has ADHD, and my daughter Daniela is hard of hearing. And after introduce myself and a little bit of my life, I want to say that I hope you and your families are safe and healthy during this public health crisis. And I also understand that maybe it is an overwhelming time, and I really appreciate that you have taken the time to join me, even if it's just a little bit of this presentation, because I truly appreciate very much to listen your experience and thoughts. Family Sessions, New York State Children and Youth with Special Healthcare Needs Regional Support Center. That's the acronym. So it looks like that is random letters that when you put them together is hard to pronounce, right? But it stands for Children and Youth with Special Healthcare Needs. And this is a project that...
Do you actually pronounce it in a shorthand? Or how should I say it?
Yes, it's nice that you asked me for, because I love it that you asked me for. Many people is not asking, and it's like chinga. So it's hard to say, right? Thank you. Good. It stands for Children and Youth with Special Healthcare Needs Project. We don't say CYSHCN. We just said Children and Youth with special healthcare needs. Is all. And the first time that you say it is like, wow, that's a lot. But you get that. Okay. So let's go and check the next slide that I prepared. It says that USET, for whoever it doesn't know what it means, is University Center for Excellence in Developmental Disabilities. And about us, we are improving lives of people with IDD. And I would like to mention what IDD means for any cases someone that is listening doesn't know. It stands for Intellectual and Developmental Disabilities, right? And then we are multi-specialist center for clinicians, researchers, educators, and more. Of course, professionals who carry out culturally sensitive, evidence-based services and education. For over 60 years, we have provided services to low-income and underrepresented communities. At Einstein, Rose F. Kennedy Center is USET. We are also working with Westchester USET and Rochester USET. So we are not alone, okay? And here I like to say that it's not just me, because I am here speaking with you. Is a great, unbelievable, and very involved team members with children and youth with special healthcare needs. And Albert Einstein College of Medicine, and the co-director of RFK USET, Dr. Karen Bonnock, and Joan Siegel, as well as a co-director at the same place. And then under the USET grant, Children and Youth with a Special Healthcare Needs Project, we are like Rachel Passmore, Shaniqua McKenzie, myself, and Miriam Franco. Project Director, Project Administrator, Family Specialist, Marcelle and Miriam. So Children and Youth with a Special Healthcare Needs Project. I like to say that in this case, our goals are provide, as you can see in the screen, technical assistance to local health departments and collect and maintain comprehensive statewide resource directory, engage family of children and youth with special healthcare needs. But we are having virtual discussions because COVID made us to change the way it was that we were meeting in person, and now the discussions instead of being in person are online. We are doing it like we are doing now over the Zoom, and is being so well so far. This is part of a large outreach effort of the New York State Department of Health to hear from family members and individuals themselves about their experience and special healthcare needs. We are holding these conversations with diverse groups and individuals across the state, and our goal is to come up with concrete recommendations to inform policies and programs for the New York families. And we also plan to provide to the local health departments with resource guides and trainings to support families in New York, and also in hearing about your experience, the experience of families that are in this specific situation, taking care of children with special healthcare needs. Even ideas, they are absolutely an extremely important part of this project, because the family's views will directly impact the support offered to families in the future. So it's like wrapping it up and make it better. And I like to highlight that everything we talk about in our discussion is recorded and just used to transcript and send to the New York State Department of Health for them to improve the service, period. That's important because there's many families and parents up there that they are afraid for any circumstances they are going through about that. And I love to mention it, okay? So far, so good. So questions that you have, do you want to ask?
I have a question. I'm sure you're going to mention it later. I think I'm jumping in, but when did you start this project? You already started this project while
we started in person, but now we had to, since COVID appears to our life, and we could not continue having the sessions in person. We just have it over the Zoom since March that we started. And
okay, so it's really not started quite yet, kind of thing, because of COVID, right?
Yeah, I mean, so it's countable. Mm-hmm. We are having sessions, and they are reported to the New York Department of Health.
Already, okay.
Yeah, I have a quick question too. So, do you evaluate the student? I mean, do you evaluate the kids who has the disability and learning disability, or after the kids was evaluated as okay, this kid has a learning disability, then you're gonna take care, you're gonna give a service. Well, you're gonna evaluate. I mean, you evaluate the kids.
We are not providing services. Mm-hmm. We are not evaluating anybody.
Okay.
It's very important and so interesting what you asked for, because we have these discussions, virtual discussions now with families, mm-hmm. To hear about their experience and ideas, mm-hmm. And to know from them what's happened. For example, I would like to mention some topics, and then you might will understand better. Transition, diagnosis, and access to services, the school system, or early intervention and therapy, community integration. For example, what type of community school program does your child or like to participate in? And also we talk about support, because we kind of know that having a child with a special healthcare needs often adds another element of stress or complexity into family life. And we asked specifically what type of supports the family were helpful for your child. And we just take all of this information, we transcript it, and we send to the New York State Department of Health, and they have approved. Wow, it's like thousands of parents that this, like me or Miriam, as I said before, talk with you guys, and we get the point, the absolutely and clear and clean point for the New York State Department of Health, and say, hey, I know what I have to know. I know what I have to go, and I know what I have to do to improve the system. Maybe not for you right now, because you already had this experience with your child, but maybe for the future, that we are working with the 5 boroughs. That's huge, because usually the people is based in the Bronx or Queens or Manhattan. Look, we are all over Long Island, Suffolk County, and Nassau County. So that's great. And this is what Yuko was saying earlier. That's our flyer.
About the duration, the date range is 1 year. And then do you get only 90-minute one-time discussion? You participate one discussion for 90 minutes and get $75 and you are out? Or it's continuous?
No, exactly. Oh, thank you so much. That's great that you asked me for. Yeah, that means that if you are a mom, you are a dad, you have a child, or you with the special healthcare needs from 0 to 21 years old with developmental, emotional, intellectual, learning, medical, physical, is like broad. Even if you have asthma, your child, right? Special health care needs. You can join us for a discussion about your family's needs and experience. And then we opened these discussions from June 2020 until June 2021. But it's just one-time thing. We recruit families, you participate and you choose. I would like to participate 90 minutes in a virtual group discussion, and I'm going to receive $75 through an Amazon gift card to spend in everything I wished. And it's just because I participate, I cannot participate again doing the same 90 minutes virtual group discussion, or either to the 60 minutes individual form interview. So you just have one choice, one time, because it's the same individual saying exactly the same information. We don't want to hear twice. And fortunately, we are listening to many parents that they have things in common, but each case is so different than the other, special and unique, because every parent, every child is different, right? So even if you are under the same, looks like the same evaluation, have my child that is under autism, whatever, you already explained to us through many questions which things you were experienced, and then we just report it to the Department of Health, and they will work it out. And then
yeah, so I have to admit I didn't click for more information link, so probably it's there. But if I have 3 kids and they are different age, different needs and whatever, then what happens?
That's great, because and then we are going to base Yuko as a mom that have 3 children. It doesn't matter if they are yours or you are a foster parent with some of it, doesn't matter. You are welcome to connect with anything you want to talk, and you can talk about every of your children. We are going to take your experience as a mom going through everything: transition, diagnosis, access to services, school, early intervention, therapy, because it's an experience that we are going to get the point and give it to the New York State Department of Health. I answered your question?
Yes, thank you.
Okay, we are working.
Can I ask a question?
Sure. Who?
This is Taryn.
Taryn.
Hi. I'm sorry, I came in a little late, so I didn't hear the beginning of your talk, and I apologize for that. But when I look at this flyer, it's not clear to me if this is this some kind of survey that where you are collecting data for research, or is this a program that actually helps individual families?
So we are having discussions. We are hearing about the experience of parents that they are taking care of children with special healthcare needs from 0 to 21. We are receiving this information through those groups that we call discussion groups, that right now they are virtual because COVID-19, it doesn't allow us to get together. Or we have the individual calls, and then you participate one time, and we take all of this information and we translate to the New York Department of Health, and they will improve the services.
Oh, I see. So it is for research, essentially.
Yes, we are.
Okay, I understand now. The other thing that's not clear to me, I see Einstein and I see Montefiore are collaborating, but there's no department within either one of these universities that tells me who exactly you are.
Well, I think that is because you missed it, our first slides, that is where we were saying we are USET, University Center for Excellence in Developmental Disabilities.
I see. Well, you asked if the flyer was clear. So
sure,
if the flyer is the only thing that people are seeing.
You're right. You're right. So we, instead of give information with this acronym that many audience, it doesn't know where it's coming from, we would like to make as a reference, because we are Montefiore and Einstein. It's
okay.
So it's easier for the people that is looking at, like you, to connect. Oh, I know who they are.
Okay. And another question is this information, when you say you're giving this information to the New York State of Health, are you giving identification of people's identity, or is this confidential?
They don't want to know who we are. They just need to know through those discussions that we have topics that we are talking about. We are asking what's happened, which was the experience of the parents to get the right transition, the right services, the diagnosis that they need. And then we collect all of this information and we give to them, and they, after review it, they said, wow, it's an amount of people that it went through this and this and this. So they put it together and improve for the next. So we transcript and send to the New York State Department of Health for them to improve their services.
And then do you follow up with the New York Department of Health?
Yes.
Okay.
So, and when, and that's so important, thank you. When we get those results, we share with the parents as well.
Oh, wow, that's unusual. That usually never happens.
They are they are so engaged.
You're froze.
Yeah, we lost her.
Oh, you lost me?
Yeah. Can you repeat again, Mr. Marcelle? Dr. Marcelle.
Marcelle, enough. I love my name. So let's
I know.
Marcelle is fine. It's great, actually. So I'm sorry. I was saying that I'm thinking like you, Taryn, that is a great project. Is something that I've never heard about before. And actually, I can tell that each meeting that we have with the New York State Department of Health is they are so involved to know the parents' struggles, the parents to learn from everything it happens. And you know, whatever is the experience that as a parent you have with your child, having a diagnosis and access to services or community integration, you know, is something that you learn from their experience. And it's just one thing that you can do that is improve. So it's great.
Thank you.
Of course. Thank you for asking. So let's see. This is the, let me see, English flyer, and we do have the Spanish flyer. See, very nice. And that's a little bit of what I said before. So the people that it could be included is just from 0 to 20 years old and having illness and conditions. Is as I said in the beginning, is so broad. If you have a child have asthma, we care about. And medical learning, intellectual, emotional, or any special healthcare needs. It's not, as I said here, ADHD, whatever, okay? And that's all. If someone
another question. So do we have to submit some qualification proof kind of a document, like a, you know,
no,
nothing?
Because it's clear when we are going through the questions that the parents know perfectly what we are asking for. And if you are not a parent with a child with a special healthcare needs, you will feel that you don't belong in those chats. So you don't have to prove that your children have an evaluation with the autism or ADHD or ADD. It is not required. But we have an intake survey before, and we speak sometimes over the phone when it's not 100% clear. Personally, I call many parents as well.
Marcelle, I wanted to ask, this seems much more comprehensive than other research projects that I've encountered. So I was wondering, you know, you have these psychological illnesses or under that rubric, but then you also include asthma. So I'm just curious about who makes up your group? Are you sociologists? Are you medical doctors? Are you psychologists?
I am a doctor, but I am just working as a family specialist in this project.
Oh, wow.
And we have different people with skills to evaluate.
I see, but it's more the advocacy is your interest for this project. It sounds like.
Yeah, I have to say that I'm amazed that we can help through parents' experience, thoughts, and them sharing what they were going through, and just by talking with them, somebody will put everything together and improve the system and the services for those kids with special healthcare needs. So is unique.
Yeah.
Yeah.
Did you explain earlier how you got involved in this project? Did I miss that?
Maybe.
Would you mind sharing that?
If Yuko allow me, and Soraya, I'm happy. It's just going to take me.
No, yes, please.
Of course. So I introduce myself with my name. I don't like titles, but that doesn't mean that I don't have to use them. I'm happy to use with you. So I'm a leadership in education, in neurodevelopmental and related disabilities. I'm also a family faculty coordinator at Joseph Kennedy Center. This project, this specific project, because I am involved with different grants, I am a family specialist, and the project called Children and Youth with Special Healthcare Needs. And also I am a mom, a single mom of two 17 years old. They are twins, and my son have ADHD, and my daughter is hard of hearing like me. That's my short presentation.
Thank you.
Of course.
No, thank you so much, Dr. Marcelle, because, you know, advocacy, like I told you, for me is huge, especially with children, because I'm a mother too, and also one of my kids, they are at ADHD, and other things, and is my pleasure to share my experience with the New York City Department of Education plus the IEP services, and also to know and to share, and you can bring to the New York State, the results, especially, for the, in my case, for the Latino community, how they work, how our kids, they receive the services in the public school, with my experience. And no, that's amazing, this opportunity to understand, and to have more, to put our voice, like a parent, like a mother, with our children.
Yeah, I heard you. I heard you. So I'm besides mom. I understand that sometimes with other communities, for example, I stand for and I am advocate for the Latin and Hispanic community, but it's because sometimes it's hard for the people that don't understand 100% as a first language English to get the right services, and they are going through a lot, but also the language is a barrier. So those groups that we are having, they are bilingual, and I am taking care of the Hispanic and Latino community.
Go ahead.
Marcelle, it seems like a lovely program, and so we are free then to recommend this to families to share this.
Sure.
Openly?
Yeah.
Okay.
I'm pleased that as much people we could get involved, the better. So I like to think that is something that we are gonna get at the place that many families are willing to go. And looks like the New York State Department of Health is like pushing hard to know what they can do to do it better, to improve the services. So, I mean,
wow, imagine that. A government agency that actually wants to improve things.
I'm an enthusiastic person, and but that's huge.
Yeah.
Right.
And also I want to share, Dr. Marcelle and the team. And when I share, when I make a referral for you, Dr. Marcelle, everybody, they call me back and say like, oh my God, when I call, like, is immediate service, like, yes, this is another important point, like, where the client call you, make an appointment quickly, and then you work with the clients.
Yeah.
But no, again, thank you so much.
Thank you for letting me know. Just my mom and my kids said how nice I am, so it's nice to know that. Yeah, thank you.